Good afternoon, and thank you for joining us for Measuring What Matters, Equity Considerations in Early Childhood Measurement Tools. We're looking forward to a really great session this afternoon. I have a few logistic notes as we begin. This session is being recorded and the chat is being archived. The attendees are in view-only mode, but we strongly encourage you to use the chat box to engage with the group. Use the chat box to ask questions of the presenters, and also use it to let us know if you're experiencing any technical difficulties. There is also, this session uses auto captioning for those who need additional accessibility. Although it's not perfect, if you want to activate this as a viewer, look for the words live transcript in your toolbar. Quick note on the professional development credits. David has put a link to SC Endeavor's form. So please fill up the form if you are seeking SC Endeavor's professional development credits. If the form doesn't work, let us know. Also, you have to attend the full 1 hour to receive credits. As for the CME credits, these sessions are eligible for the CME credits, but you will be getting a link in your email to the attestation forms sometime next week. We'll also be sending you a link to the recording of the session that will be made available on ICS YouTube page. I think I've covered all the logistics information. So, and you also have a link to Mr. John Conklin's email in case you're experiencing any technical difficulties. Okay, at this time, I'm pleased to introduce our presenters for the session. Dr. Tyson Barker is the Director of EC PRISM at ICS. EC PRISM stands for Early Childhood Precision, Innovation, and Shared Management. We also have Katie Hammond, who's the Director of Science Communication, also at EC PRISM at ICS, and Dr. Aimée Drouin Duncan, also at EC PRISM at ICS. She's a research specialist there. Thank you.
All right, thank you everyone for attending today. The title of our presentation is Measuring What Matters, Equity Considerations in Early Childhood Measurement Tools. And we are excited to be here at the Nurturing Developing Minds Conference today. So before we get started, I'd like to just extend a thanks and thank you to our sponsors and foundations who fund our work, as well as our partners, and especially the Institute for Child Success and PRISM Health for sponsoring this amazing conference today. So first, I will be doing a brief overview of equity considerations and measurement, and toward the later half of the session, Katie Hammond, our Director of Science Communication, will give a web demonstration of our impact measures tool. So we'll start with, for the agenda today, who is EC PRISM, followed by a little conversation on measurement and equity. I will introduce you to some of the concepts of what we call the impact measures tool. We'll do a website demonstration, and then following this presentation, we'll have a live question and answer session. So first, our vision is we envision a world where young children and their families receive the support they need to thrive, no matter their background. And our mission is to empower organizations in the early childhood field to accelerate their own impact by harnessing measurement and evaluation practices to fit their needs of their communities. And what we do is we develop customized tools, resources, individualized support. And what is of particular importance in this presentation, we talk a lot about assessment tools and measurement tools, but we are a non-affiliated resource. We don't directly work with any measure publishers or developers. Rather, we hope to provide tools to the field around assessments in early childhood. And before we get started, EC PRISM, we currently are located under the umbrella of the Institute for Child Success. So we are a team within the Institute of Child Success. So first, before we kind of move a little more forward into talking about equity and measurement, I'd like to use this analogy using data, using assessment data, measurement data as a flashlight and not a hammer. So what do we mean by that? Well, what we often see is assessments are used oftentimes for accountability purposes or regulations, where we are required to do certain assessments or certain measurement tools in education and healthcare, and in our focus in early childhood education as well. And what we often see is that the information isn't really used in any meaningful way, but rather is more compulsory. You have to do this assessment. And what we hope by the end of the presentation is to get everyone thinking about using data and assessment data more like a flashlight. And what do we mean by that? We think of assessment data as a way to shine light on things that maybe we don't see as clearly. So the data can help us see the story a little more of a child's development and how they're thriving, or maybe help us understand where parents or children may need more support. But we also want to recognize that as practitioners and educators, sometimes you may not need that flashlight. You may not always need assessments to help you. You may be able to use your intuition and expertise and to be able to have a sense of where you need to spend more time and how a child is thriving. So we want to recognize that not everyone needs a flashlight, but also that sometimes it can be helpful to use assessment tools in that way. And ideally moving away from the idea of using a hammer as the main way, assessment as a hammer is the main way that we think about data. All right, measurement in early childhood. So before we dive in a little deeper, these are kind of our principles when we have a conversation around measurement and assessment. So first, it's complicated. There's a lot of assessments out there. There's a lot of measures out there. They often have similar names. They may use that names in different ways. They may have the same names, but mean different things. There's words like social emotional development, executive function. And so we want to recognize that it's pretty complicated. And that's just kind of where we are as an early childhood field right now. The second part is there is no one perfect measure or perfect assessment tool for everyone. So if you ever hear someone say that they found the best or perfect assessment tool, we hope that you can challenge that, that statement. And relatedly, the second part is there is no one perfect assessment tool, but it also depends on your needs. Depending on your role and the community and the context in which you work, you will use assessments in different ways and for different purposes. And what we hope to convey is that you may find the perfect measure for you, but there is not a perfect measure for everyone. So when we do a website demonstration a little later, we'll hopefully demonstrate ways in which you can weigh certain considerations based on your needs and context to find the perfect measure for you. Last, we want to take a strength-based approach when we think of measurement. So measurement can help and demonstrate how children thrive. So assessments and measurement tools are often, like what I was talking about earlier with the hammer metaphor, is that it can oftentimes be used as a way to, punish educators or practitioners or children. And what we really want to use it is, again, using it as a flashlight and really with the focus of helping children thrive. So before we dive into equity considerations, it's important that we talk about the misuse of measurement in the past. So measurement has been used for a very long time to promote racism and sexism as a way to validate these ideas. So we see this in the past 200 years in ways in which measures have been thought to be objective, but rather were used to promote these ideas. Now, we still see remnants of this today. So if you see that, the SAT or the GRE or these other high stakes assessments that really put a lot of pressure on the individuals who are completing the assessments or the systems that are being judged based on that information. And on the far right, you'll see a comic where it's a teacher and you'll see a student in a line of people to the right, and the teacher saying, any of you actually want to teach? So we also now often see a sort of industry around measurement and assessments, where we have a lot of individuals who are very interested in how educational systems work. and are very interested in improving outcomes and have a lot to say about it, whether assessment or curriculum developers. But oftentimes what we see happen is at the end of the day, does anybody actually want to teach and improve instruction and to collaboratively work with educators and practitioners in improving instruction? So moving forward, it's important to acknowledge that measurement has been used to promote racist and sexist ideas, systems, and policies. And we also want to acknowledge that this continues to be the case. We see this, the remnants of this day, and the remnants of a lot of previous policies to this day in a lot of differences in outcomes. And we also want to continue to closely consider, and we should always be asking ourselves, so where does measurement do damage? Where is measurement actually promoting family wellness? And what we've learned is that it's not always cut and dry or black and white. What it actually is it's a lot of gray sometimes, and we just need to be very considerate and careful and intentional when we want to introduce new assessments or new measurement tools. So moving on to equity and measurement. So first, I want to review the statement that we often say is what we measure is what we value, or you could also say what we value is what we measure. So what does that mean? So all measures and assessments are created in some way because we as a society value the questions or the material in the assessment. So one great example is a science test or a math test. So whatever is in that science or math test, we value and say that's important to learn. And what we've often seen is that is often taken for granted. It's an assumption that this is objective, that whatever these decisions are of what's important in a standard or what's important in the field, that it's agreed upon. Now, we often see that those who make those decisions may not be the same individuals who are the ones filling out the forms of the assessments or having information collected about them. So a few guiding questions that we think about is one, are your measures aligned with your community values? So again, measures may oftentimes may be misaligned and often are created by someone who may not be representative of the community in which the information is collected from. And it's a very easy way to do it is look at the standards in a measure, look at the questions being asked, and begin gathering information. Is this aligned with the values, the community that we're collecting information on, or is it not? Can we ask those who we are working with and collecting information from, does this make sense to you? Is this a value to you? And if it isn't, we highly suggest considering other sorts of assessment tools. Does the community you serve actually want to be measured? So we often take this for granted, and this is something that I am guilty of. In a lot of those who work with data and measurement tools or research have the assumption that more data is better, more measurement is better, and that everybody has that belief. But we do know it's a real burden on educators, practitioners, and families to be measured. The burden of the administration, but also what questions are being asked. Is it sensitive to the community and the families that we work with? And it's important to have and consider that before making a decision on assessment. The other part that we really hope you all take into consideration is that language and culture matter. So first, ignoring this will always make a bad measure. If you do not think of language and culture in the development or administration of assessment and measurement tools, it will lead to bad data and data that may not be valid. So what do we mean by language and culture matter? Well, first, language is a driving part of many assessment tools, whether if they're parent report tools or other sorts of emergent literacy and language measurement tools. And there's the assumption that if you create a measure in a certain language and you translate that measure, that new measure is valid representation of what you are hoping to measure in the first place. So one example, say we have a parent report measure on early childhood development that's in English. we translate that to Spanish and we say we have a validated Spanish measure. That is actually not the case. Every measure, when it is translated, needs to be revalidated. And what we've often found is a very lack of validations of measures outside of English. So we hope on our site during the web demonstration, we'll talk a little bit more about that and see how you can compare and find different language versions. Second, culture matters. Again, with this translation, if we had a parent report and child development measure that was translated to Spanish, there's the implicit assumption, again, with the values, that development in different communities or different cultures occurs the same way. And what we know is that is not the case. Different cultures value different aspects of child development, different parenting practices. And it's important to consider that that culture is always part of a tool. And again, what we measure is what we value, highlighting that and thinking through, well, what we're asking, is this valued or representative of all cultures or certain cultures? So introducing the impact measures tool, we've over the past few years have created a website, which is a free database of early childhood and parenting measures. Now on this website, you can search, compare, access measures on 4 key dimensions that I'll explain a little later in the presentation. You'll also find high quality measures that work for different communities and contexts. In addition, we also have measurement and educational resources, so you can learn about some of these information about measurement and concepts that tend to be pretty complicated, but really are important for you to know when choosing a measurement tool. So before we dive into the 4 categories, I'll review the impact scoring system. So you'll see a little picture below, and I'll kind of walk you step by step through how we score measures and think through finding measures using our diamond. So the scoring diamond below visually displays the measure scores in each category. Those 4 categories: cost, usability, cultural relevance, technical merit. I will review those in more detail in a few minutes. And what you also see is this yellow shading. So that was what we think of as the measure score. All measures are scored on those 4 key areas from 0 to 10. 0 is a lower score, 10 is a higher score. So what that means in terms of the yellow shading is the more yellow shading there is in the diamond in each of those areas, it means a higher score. So walking through the example below, you'll see technical merit on the left side. You'll see there's a lot of yellow shaded area, in that section, meaning there is a high technical merit score. Now, if you look on the other side for usability, you'll see there is no yellow shaded area on usability, meaning the measure has a very low usability score. All right, so this is the real fun part. So you on the tool can set your own preferences and for a desired minimum score in each category. So the purple dotted line that you see represents what your preferences are. So we'll give a demonstration during our web demo where you can kind of look at those preferences and adjust those. But basically what it means is you have the ability to set your own scores. So in the example below, look at the bottom, cultural relevance. You'll see that the purple dotted line goes very close to the edge there, meaning that we have a preference for a measure that has a high score in cultural relevance. And the goal is to have the yellow shaded map to your purple preference diamond. So in this case, if you look at the areas of cost and technical merit, you'll see the shaded areas are very close to the purple dotted line, meaning that our preferences are very close to what we're the actual measurement tool that we're looking for. So likely what we're looking for in terms of technical merit and cost, this measure is a good fit. If you look on the other side for usability, you'll see that it's very, very different. We have we wanted something that was higher in usability, but has no yellow shaded areas. So what this indicates is that it's not a good fit in that area. So your job when you use our website is to have the yellow shaded area fit the purple dotted area the best that you can. All right, so the impact scoring categories, I will go through and review cost, technical merit, usability, and cultural relevance, and tell you a little bit more how we think of these different scoring areas. So first, cost, how affordable is this measure? So there's two areas that go into our thinking of affordability of a measure. One is the price. So does the measure or assessment tool have a cost per use, per administration, and how expensive is that, or is it free? The second, accessibility. So means, is the measure or assessment free? Can you download it on a website for free? Or do you have to email somebody to get permission to use the assessment tool? Those all go into the cost category. As a side note, because this is tricky, cost, a higher score or more shaded area in cost means a cheaper tool or more free tool. And a lower score of cost means that the tool is more expensive and less accessible. The next category on the impact scoring category is usability. How easy is this measure to use? So there's really 4 areas when we think of a usable measure: time, training, interpretation, and format. So time for measure administration, how long does it take to complete? Does it just take 5 minutes, 10 minutes, up to an hour? How long is the actual administration time? What we also go into when we think of time is, does it take time to set up the measurement tool to be administered? Does it take a significant amount of time after administration to conduct analyses or aggregate information in any way? And how long does that take? Is it automated? Do you have to do it by hand? So that's when we think of the time category. You'll also see in the website demonstration that time can also be a filter. So you can adjust and search for measurement tools based on the amount of time. Next up is training. How hard and how much effort does it take to train on an assessment tool? Is it as easy as finding the assessment tool and just delivering it, administering it, handing it to a parent to complete? Or does it require a degree, credentials? Does it require attending a workshop for a few days? Do you have to get to fidelity and reliability and attend additional trainings, send videotapes in, things like that? So there's a lot that goes into training, and really gets down to how much work it takes to have someone train on an assessment tool, and just how much time and effort that takes. The next is interpretation. To us, a usable measure gives you information that's easily interpretable. What do we mean by that? In terms of interpretation, does it give you information that's actionable? So if you have an assessment that's completed, is there some sort of information given that says, is this child developmentally on track, perhaps at risk, or need further evaluation? That's an action and a decision point that gives you clear information of where you need to go, perhaps for a longer or more thorough developmental evaluation. Or is it just giving you a sort of random number that doesn't have a lot of meaning that you have to figure out what to do with later? The last is format. We think of format in terms of, are there multiple options of administration, pen and paper, pencil and paper, digital administration via tablet or computer, things like that. All right, so the next scoring category, cultural relevance. How well does this measure serve different groups? So there's 3 main areas we think of what makes a culturally relevant measure. So demographics, so bias in measurement, and bias in the process to creating a measure. So when we think of demographics, when a measure is created, there's typically what we call a group of individuals who are the sample that the measure is created from. Now, the idea is that we want a good measure to be representative of, in our case, of everyone in the United States. So a more diverse demographic sample of race, ethnicity, and gender, for example, when a measure is created, likely means that measure will work or be valid for more and different demographic groups. So what we look for here is what is the diversity of the demographic groups when the assessment tool measurement tool was created, and how closely does that align to census level data in the United States? Next is bias in measurement. So when we think of that, what we do is we want to think of, okay, we have sorts of questions on an assessment tool or information we're collecting. Do different cultural or linguistic groups answer it the same way or different ways? There's ways to actually statistically look at those differences, and it helps tell us whether items may be not as hard or difficult for different individuals or look similarly across different individuals. And we often use gender and race ethnicity as a way to do that. So we can test, is the measure working the same way? A culturally relevant measure will do more of those tests and will provide more information demonstrating that there are no biases across individual questions. Last is the bias in the process to create the measure. So what we hope to do is whether when the measure was developed, was the community who should in the long term be who's having information collected from, are they involved in that process? Getting back to what you measure and is what you value, are we pulling those values out to understand whether this assessment or measurement tool had a process where they were consulting the community and getting information about these items. So one great example, there's a measurement tool for kindergarten readiness. And in the development process, the measure developers asked kindergarten teachers what it meant to them for a child to be ready for kindergarten. So they did focus groups and interviews, collected that information, and that became the basis of a measurement tool for kindergarten readiness. So in that case, they consulted kindergarten teachers, given it was related to kindergarten readiness. So similarly, one step further would be if we were working with certain communities here in Oregon, are we consulting with the Oregon community when we develop our Oregon kindergarten readiness measure? The last category is for the impact scoring is the technical merit. How consistent and accurate is this measure? So 3 areas that we talk about here: reliability, validity, and what we call norms or norm referencing. So first, reliability, and we often use the word consistency. So when you hear the word reliability, think consistency. And what that means is the assessment consistent? If a child were to complete an assessment on Tuesday, do they get a similar sort of score on a Thursday, for example? If they were to do it Thursday morning, do they get a similar score if they do it on Friday afternoon? The idea here is that this measure is trying to tell us something about a child's development or parenting or parent-child relationship. And we think these things tend to be somewhat stable among children and families, and a measure needs to be consistent for us to really trust this information. The next is validity. And here, when we think of validity, we think of accuracy. So is the measure accurate? Is it measuring what it says it will? So this one gets a little confusing, but the way we think of it is when we develop an assessment tool, is the assessment or measurement tool similar or related to similar assessment tools? So if we have one, say, measure of kindergarten readiness, we hope it's related to another measure of kindergarten readiness. But what we also do is make sure it is also different than measures that are very different. So what I mean by that is if we have a measure of kindergarten readiness, we would hope it would be, say, different than a measure of child health, for example. Yes, they may be related, but we don't want them to be very strongly related, because the idea is if we think this is kindergarten readiness, we really need to demonstrate it's specific to this area and unique and different than other areas of development. The last is what we call norms. When we develop a measure, we want to have individuals who represent a wide variety of abilities. And part of developing a measurement tool is to collect this information and be able to what we call have a sort of normal distribution, which helps us understand where children say fall or children and families fall in relation to other children and families. So in that case, that norm referencing helps us compare. Is a child on track of development compared to their peers versus not? A side note, there's other sorts of assessments that aren't what we call norm reference, meaning it isn't aligned in comparing to others, but to a standard, so sort of criterion reference. So how are children or families doing to a set standard? All right, so one interesting part we'll talk a little bit more about is this concept of measure families. So in our development process of the impact measures tool, what we realize is there's a lot of measures and assessments that have similar names or same names, and they seem to be very related to one another. And what we found is that if you look at those different assessments, they're actually, they share some common elements, even though they're slightly different. And what do they share? Well, they tend to share language, or they tend to be different on language, for example. So different language versions. They may be a little different in topic area and age range, but they tend to share some sort of concept around how they talk about, for example, kindergarten readiness or parenting. And what we've learned is it'll look like one assessment, and we often hear individuals say a name of an assessment or measurement tool. And what they mean is it could be up to five or six different sort of assessment tools. So one great example is the Ages and Stages questionnaire. So what's known as the ASQ. The ASQ is a developmental screening tool often used in healthcare, as well as center-based care to screen for child's development, whether it's on track and whether a child may need a referral for additional services. So we often hear the field say, oh, we administer the ASQ. Well, actually, the ASQ, there's multiple versions. There's the ASQ 3, that's the big one that kind of covers all areas of child development. But there's also the ASQ SE, social emotional, that focuses more on social emotional development. Also, as I discussed earlier about language versions, there's the ASQ Spanish, for example. That's a different measure than the ASQ English that has different scores. So if you ever when you hear those sorts of words, and someone says we administered the ASQ, or we administered the SWIC, another developmental screening tool, typically the follow-up should be, well, what were the language versions? And tell me more, what exact version did you use? Because there's usually a little bit more information. And what we've done on our website is we organize that information in an easy way so you can dive in and see those differences, see how the different measures scored. All right, so thank you all. This is the end of my part of the presentation. What I'll be doing is turning the presentation over to Katie Hammond, Director of Science Communication, who will be doing a website demonstration of our impact measures tool.
All right, well, thank you so much, Tyson. So I will dive right in here, giving you all a demonstration of our impact measures tool website. I will be walking through the different parts of the website, showing you how to search, compare, and access measurement tools that best suit your needs. And I'll do a couple of example searches along the way. So as you'll see at the top of the page, you'll find that scoring diamond that Tyson was mentioning earlier with our 4 scoring categories: cost, usability, cultural relevance, and technical merit. And as Tyson had mentioned earlier, you can update the preferences to kind of better find measures that align with whichever scoring categories are most important to you. So I'll show you right now how to update your preferences. Going down to this button here that says edit, you'll see this pop-up that shows you the 4 scoring categories and will allow you to select different scores for the 4 different categories. So let's say that you are looking for a measure that has high usability and cultural relevance. You can click this button right here and update in live time. You can see that as you increase the score, the dotted line on the right will kind of actively change shape to reflect your preferences. And then once you click this button down here, set your preferences, you'll find that the measures on the search page will reorder and reshuffle to more closely align to that dotted line that you've set. So clicking set your preferences here, you'll see that the measures will shift and change so that you'll find different measures coming up to the top that more closely align to those preferences. So in addition to setting preferences, you can also set different search filters. So if you look on the left, you'll have a column here that has a variety of filters to refine your search. And then on the right, you'll find the kind of previews of the measures themselves. So you can see the title, a brief blurb about each measure, as well as a little preview of that diamond image itself. So you can get kind of a sneak peek of what those scores are. And when you find a measure that you like, you can either compare them to another measure, or you can directly click into them to learn a little bit more in-depth information about that measure. So for now, kind of going back to that left side, looking at the filters, if you're interested in kind of narrowing down and creating a more specific search, you can use one or more of these filters here on the side. So first we have topic. If there's a specific topic that you're looking to measure, you can select that here. We also have cost. So if you're looking for a measure that is specifically free and accessible, you can select that here. So we have a filter for cost. Age range. If you're looking for a measure that is suited for a particular age of child, you can select that here. We also have respondent. So this is similar to kind of who is filling out the measure and for who. Is it a caregiver self-report? So they're reporting on themselves. Is it the caregiver reporting on the child? So if you're looking for that kind of setup for a measure or an assessment tool, you can find that here for who is the respondent. We also have the administrator listed here. So if you need a measure that is administered by a certain type of professional, a clinician, a teacher, or a caregiver, you can find those here as well and filter on those. We also have measure types. So this is another important filter. There are, of course, different types of measures, survey tools, specifically screening tools, direct assessment, observations, and interviews. So if you're looking for a particular type of measure, you can select this filter. We also have languages. So we have a variety of languages that you can search for measures here, selecting this filter. And then finally, we have time to complete. So the time required to complete the measure. If you're looking for a measure that you really only have a few minutes available and you need it to be kind of very quick and straightforward, then you can select the time amount that you have available to administer the measure here on this filter. So now that you all have a sense of the different kind of search patterns and options that you have, I'll scroll back up to the top and I'll walk you through one or two examples for how you might search for a measure using this tool. One last piece of how to search for measures is if you have a sense of the exact title or the name of a measure that you're looking for, you can directly type that into the search bar here. And so in addition to the filters and the preferences, you also have this available to use if you would like. So let's say, for example, you are familiar with the ASQ, the Ages and Stages questionnaire, and you'd like to learn a little bit more about how it scores. You can directly type in ASQ, hit search, and then it looks like we have 4 different results. So these 4 measurement tools are all part of the ASQ measure family. So as Tyson had mentioned earlier, all of these measures are related to each other in that they are all generally under the Ages and Stages questionnaire umbrella, but they are slightly different. So for example, we have the ASQ in Arabic, we have the ASQ for social emotional development, we have the ASQ3, and we also have the ASQ3 in Spanish. So as you can see, these are all interrelated. They're all within the ASQ grouping or measure family, but they're all slightly different and they have slightly different information and slightly different scores. So let's say that you're interested in looking at the ASQ3 and you'd like to compare it to something else that might be out there. So you already know that you'd like to compare it. So you can click this button here that says compare. And then you can go back to your filters and you can look for different measures that you might want to compare against this tool. So looking at your tool, you know that you would like to search for a screening tool, for example, that focuses on social emotional development that you'd like to compare against the ASQ. So knowing that you're looking at social emotional development, you can click this button right here. And then looking at the measure type, scrolling down, you can hit the screening tool. And then the measures will update in real time based on those filters, but also based on the preferences that you've set earlier. So you're looking at the list, you see the one that kind of floats to the top is the SWIC preschool. So the survey well-being of young children. It looks like it has relatively high scores. It seems like it's comparable in terms of its topic. So you click compare. And once you've found all of the measures that you'd like to compare against each other, you can hit this button compare, and it directly shows them side by side. So here on the left, you have the ASQ3, and then on the right, you have the SWIC preschool. So again, you can see the scores of the two measures, and now you can look at them side by side and really directly be able to compare them. So it looks like the ASQ has a lower score in cost and cultural relevance, but a relatively high score in usability and technical merit. And then looking on the right, you can see that the SWIC has a very high score in cost, which means that it's free and easy to access. It also has relatively high scores also in usability, cultural relevance, technical merit. But as you compare the two, you can see that the technical merit is a bit higher for the ASQ. So that's a consideration for you. But as you are kind of remembering your priorities, thinking about the usability and the cultural relevance and comparing the two, it does look like the SWIC scores higher in both of those realms. So for that reason, you're leaning a little bit more towards the SWIC, but you'd like to look at a little bit more information. So scrolling down, you'll see this descriptive information related to the type, the topic, what year it was published, and the age range. So if it's important for you to have a very specific or narrow age range, then that's something that you can compare directly here. Finding other information about the way the measure is administered and whether or not there is an electronic version available. The length of time to complete. So if that's something that's very important to you, then that's also something that you can compare directly here. And again, you'll also see here for the cost, the ASQ is at cost and the SWIC is free and accessible. So looking at those two, that's probably one of the important factors possibly for you as well. We also have some additional information, these kind of did you know fun facts about the measures where you can learn a little bit more about the measure, as well as the languages that they're available in. So let's say that you've made your decision, you're interested in pursuing the SWIC measurement tool. And so since it is directly kind of free and accessible, you can click this access measure button and it will take you directly to the website where you can access and download the measure. For a measure at cost like the ASQ, if you click the access measure button, it will take you to the publisher website where you will be able to purchase the measure. So in either case, this button can take you to where you can directly access the measure. So let's say that you would like to think a little bit more before deciding and you'd like to come back to this website later to use it as another time. You can actually save these measures for later. All you have to do is click the heart in the upper right hand corner, which will add these measures as your favorites, and you can come back to them later up here at the top under my favorites. So clicking on my favorites at any time, you can come back to this page and find those measures that you've saved for later. So that's a little bit of a walkthrough for how to search and access measures. If you'd like to learn a little bit more about our scoring system, you can click our scoring page. And if you'd like to learn a little bit more about measurement and early childhood, you can click our Learn page to access our learning resources. And so with that, I'll turn it back to you, Tyson.
All right, thank you, Katie, for the web demonstration. So please connect with us. So we hope to have our new Impact Measures Tool website at www.ecmeasures.instituteforchildsuccess.org. In the meantime, you can also find our website at impact.ecprism.org. Also, feel free to email us if you have questions, comments. Are there other measures or assessment tools that you hear a lot about that you would like for us to include? Also, what are some concepts out there that you've heard about that you wish you could find some more information? So please email us if you have any questions and any ideas for additions. And you can also find us on social media at EC PRISM. All right, so thank you so much. This is the end of our recording, and we're going to turn it over and you're going to see us in person in just a second.
Thank you so much for your presentation. That was great. That was a lot of great information and a really great tool. We have some questions in the chat. So do you want to, have you been monitoring the chat? Do you want to just answer some of those questions?
Yeah, I'll go ahead and please, yeah, go ahead and type in any more questions if you have, and hopefully take a few while I'm talking. So yeah, I'll first, I think I covered in the recording, which was perfect, was if you want to request an assessment, Katie maybe put the email address in. So if there's certain assessments that we don't have up there, yes, please email us and we're happy to see about including. It's always a process and takes some time to get the materials. So we'll usually, we can keep you updated if you're interested. It usually takes a while. Okay, moving on to two other questions. Measurement for accountability. This is our favorite. So measures are always used for accountability in K-12, right? So think of No Child Left Behind, put a lot of standards around improving test scores, particularly around math and literacy. So we're beginning to see that, that kind of K-12 mindset move into the 0 to 5 space. What we're hoping to do is let's think a little bit differently. There's a few reasons why that we hope to kind of move away from accountability. We first want to recognize accountability, measurement for accountability does have a purpose and a use, but it needs to be really clear what's it for. Usually when people say measurement for accountability, depending on what camp you're in, it often means, at least in the early childhood, population level monitoring. So what we often see is, in the example that was put in the chat of the class is a quality improvement tool for early educators. That tends to be aggregated at centers and then reported upward to the state. And that is not the purpose of that tool, to use it for population level monitoring. It often then is used for service funding reasons as well, which we highly suggest against. So part one is just purpose. Is it for quality improvement? Is it population level monitoring to know how to direct resources? We often see it at the state level. The phrase we hear, which we hope to move away from, is when we ask this question, what do you want this measure to be used for? Accountability, population level monitoring, individual assessment, quality improvement. They say everything. We want it for everything. And what we want to say is that there is no, that's impossible. So it's really good to be clear on that. What's the use? So, and this has to do just with the class. We see this with formative assessments like the TS Gold, the DRDP out in California as well. So this gets aggregated up to the state. Part two is this concept of using measures for accountability, something called Campbell's Law, which is basically whenever you try to put pressure on some sort of test, people are really good at figuring out ways around it, in short, which is the concept of teaching to the test. Whenever you have a tool and you say you have to reach a certain score, we're all really good at it. And I am guilty of doing this as an early interventionist. I definitely know when I was being judged, I made sure those scores changed over time. I believe they also did, but I also perhaps was a little influenced because my job was online. We also just have to accept that and be really, really careful with how information is used for accountability and the pressures it puts. We often see it ends up doing more damage or it appears as if there's improvement when the improvement is actually people just got better at teaching to the test. And most of the data out there, I would actually suggest a lot of improvements are actually related to people just got really good at the test, the outcomes didn't actually improve. That's kind of where it is, and it's a hard problem to get around. There's not an easy answer. Gosh, seal of approval is the next one. I'm not monitoring the others as I kind of just keep talking. So Vasanti, Katie, just let me know, where I need to go. So, okay, seal of approval. I hope the concept of there is no perfect measure gets through, but measure developers often think their measure is perfect. So we definitely have to deal with this on occasion. But where a measure developer may not agree with the scores that we've given, but for the most part, measure developers have been really responsive and nice. But I think that's the purpose, is we want to challenge measure developers to make better assessments, to make them more usable, to be more considerate of validating measures in other languages. So we hope our tool, and what we really try to do is a non-affiliated resource. We're interested in all measure developers doing better. We're interested in the field doing better. And we think that this tool can help promote that.
We currently don't have any more questions. Participants, if you have any questions, please go ahead and use the chat. Tyson, I have one more question. You mentioned with the class that it was created for a classroom level, but it is inappropriately, I hope it's okay to use such a strong word, aggregated at the program level and then once again used for high stakes funding decisions. And kind of going to what one of the participants wrote about the politics, what kind of advocacy measures can somebody take to address issues like this?
Yeah, great question. So I think there's a few larger issues here, is that when regulations are put in place at the state or federal level, we want quality assessments. Like, I think we generally agree on that. But what ends up happening, this is particularly happens at the state level, is there's oftentimes efforts by certain measure developers to have exclusivity of their tool within a state, for example. And I think what the unintended consequences of that is then that's basically all the data you have to aggregate, because you kind of like settled on a certain tool for multiple purposes. So I think part of it is there's this issue of what's approved, what's not approved, and we hope states can be more open and have a more like transparent process to new measures coming in that may be better or different. I think part two is I think we've kind of put the onus right now on using data and measures correctly on measure developers. So often at the state level, what we see is there's kind of a lack of understanding of, can I do this with the class or not? Can I do this with the TS Gold or not? And there's just not a lot of guidance in helping states understand what you can and can't do. And the way I describe it is there's typically for a lot of these tools, there's like a best purpose. The class is really meant for quality improvement. Like that is where it stands. But you can kind of aggregate it at a program level and kind of get a sense. But there's a lot of caution and flags that go with that. Another example, the ASQ is a screening tool, and there's been a lot of efforts to aggregate that within health systems to look at change in child development or how health systems are performing. It's really not meant for that. It's really meant for a provider to administer and flag children for referral. So again, you can probably do it, but you just have to be conscious and aware. So I would say short term is what we hope to do is raise awareness of the different purposes of these measurement tools. And then part two, I think through that process, we really see it at the state level and the provider level to advocate for their needs more. So we don't want you to get intimidated by these, terms like validity, reliability. We hope to kind of give these terms so you can go out and say, hey, this isn't really going to work for us. This is what we need to do and use a tool for this purpose.
Sorry, we have a question. I'm going to read it out. So the CR factor, I think that's the cultural responsiveness of the measure, of a measure specific to that version of the measure. Do we need to look at different language versions to see the validity and cultural relevance?
Yeah, I'll take the first one, and Aimée, you can nod if you want to take the second one, or I can take the second one. Yeah, so kind of to this idea that every language version of a measure needs to be validated, then every version of a measure has a cultural relevance score. So what we've really found is, I think, as you saw during the presentation, we often just see measures, and this doesn't even just go for language, it also goes for culture. Measure is created in, say, an urban center in the US, and then it's administered in a rural area. That's not a language difference, but there's an assumption there that it works, right? Like it's valid. So is it still valid even if the sample is urban to rural? And that goes for all measures. Whether it's, so that kind of CR score, the cultural relevance score, really represents what we call like generalizability, the degree to which you can kind of say, hey, I think this measure may work for my community because of how it was developed. It was likely more representative. Aimée, anything on the second part?
I think you kind of did address the second part. I will say that on our website, we do have different versions of measures when they are offered in different languages, and we're always looking for measures that have more versions in different languages.
Kind of related to that, we have this interesting comment saying from this participant who says that they do a lot of work in Italy, and they view measures in a much more balanced way in Italy, and they use a lot of qualitative measures as opposed to a more standardized approach in the US. How do you view qualitative measures within the early childhood context?
Yeah, that's a great question. So for qualitative, I kind of see this as two types. So there's the qualitative when we use it as researchers, which is can be quite time intensive, which is doing extensive interviewing, recording audio, pulling out themes. And then there's this qualitative, which is I often see in clinical work as like intuition, or using sorts of like checklists or kind of mental maps or anecdotal data. We haven't figured out a good way. We definitely thought a lot about this on our website. We haven't really figured out a good way whether to include that sort of data, but or those sorts of tools. But if you have examples, please send it to the email, because we're happy to take a look at it. But in short, they follow a little different format. But to call out, we have a whole website dedicated to quantitative tools. That does not mean that we don't believe those other sorts of tools have a great place, and we often use those in our work as well.
And the last one, we have a comment saying in all caps, this is such a good point you made on how we want the measurement to be for everything, and it's such a hard habit to break. And this is especially in the context of NCLB, where measurement has come, into the forefront of all the conversations around education. So we are at time. I want to say thank you so much for this presentation and sharing such a valuable tool with all of us here in South Carolina. Welcome to South Carolina. And David is going to once again put the link to SC Endeavor's credit. If you want the credit, please fill the forms. And once again, thank you. For those who couldn't attend, please share the recording with everybody who's interested. You'd get an email with a link to the recording. Thank you very much. Bye.